Welcome to your Esse Health Patient Portal. This video will go over how to navigate in the portal, which includes messaging your provider, managing your dependents, view test results, and so much more. Let's get started. Once you've logged into your patient portal, you're going to be defaulting onto your home page. Your home page will have cards that will have some topics that we will see on our menu on the left side of your screen. If you're on the mobile device, you may have to click on the three ellipses on the left side to see your full menu, or at the bottom of your phone screen, these options will be going across. On the far right, you're going to have some indicators here for notifications. This little bell with the number 3, if I click on it, is showing me that I have 3 notifications. I have a new message, and it's showing me an appointment was scheduled for my child, Dominic. I can individually mark these as read, or I can select Mark All as read to clear those notifications. I get my action was successful and I hit OK. The second indicator allows me to increase the size of the lettering in your portal. I have mine set at normal. If I need to increase or zoom in, I can go to large or extra large print. To the right of that, you will see a circle with your initials when you log into your portal. On the mobile device, you will only see your name initials. You will not see your actual name due to the screen size. On your home computer, you will see both. When clicking on your name, you will get an option for profile. This will allow you to view your profile, general information, phone numbers, your settings, changing your password. You can also put a credit card on file to pay your bills. If you are a parent like myself, I will have dependents listed here. When I select dependents, I will see my 2 children. I cannot access their portal from here, but I can see who I have access to. Just a reminder, due to HIPAA, your child will be removed from your access at the age of 18. That 18-year-old will have to give written consent to the pediatric office in order for you to continue to have access to their medical records. Clicking back on my name on the far right, I also have an option for switching account. This is only available if I manage other patients in the practice. When I click Switch Account, I can click on the drop-down and I can now see my 2 children. I select my child Dominic and hit Switch. This will allow me to go into Dominic's patient portal, where I can then see his records, appointments, messages. It gives me a cue here that I'm logged in as another user, and when I'm done, I need to remember to switch back to my own personal account. I click OK. On the top right, I can now see that myself, Melissa, I am logged in as Dominic, my child. These are Dominic's appointments listed and his messages from his doctors. This is where, as a parent, I would message my child's pediatrician from my child's account. We want to make sure the messages are being recorded in the correct patient chart. To switch back, I just click on Dominic's name, hit Switch Account, use the drop-down, and select myself to go back to my portal. Once I'm back in my portal, I can now message my own personal doctors and I can see my appointment listings. The last item under our name drop-down is going to be the log out. When I select log out, this will sign me out of the patient portal. Now let's go through our menu. So on the left side, we are on our home page. This is going to show us these cards that have different subjects of the most popular items, such as messages, appointments, and if I scroll down, I can see my lab orders, medical records, and again, if I manage any people, I will see them listed here. From these cards, you have the ability to view all on your messages, or I could select a new message to compose a message to my provider. Same with appointments, I can view all my appointments, or I can select a new appointment request. We're going to go through these items in just a moment. Going back to our menu bar on the left side, we're going to select appointments. When I click on appointments, this is going to default to any upcoming appointments. I have 2 appointments scheduled here, and it says it's pending confirmation. If you do not see any appointments listed here, that means you do not have any future appointments. I can select where it says upcoming or all to see all my appointments listed. This is going to show me any appointments that were in the past and if they were scheduled. I also have some filter options up here for date ranges and under patient. Because I manage my 2 children, I do have the ability to toggle and view those appointments from here. But please remember, I cannot request a new appointment for my child unless I'm under their account. I'm going to switch back to myself, and I'm going to request a new appointment. I select the new appointment button, and I do have to fill out the required information. Please be advised, appointment requests are not guaranteed. Your provider's office will try to accommodate your required time and date, but if you need an immediate appointment, please contact your office directly. From here, I need to select my patient's phone number, the provider they're wanting to schedule with, the reason they're coming in, if it's for a routine office visit or an annual physical. Once I choose the reason for visit, I will get a pop-up to select a preferred date range. So if I want an appointment in 2023, in January, anywhere from January 9th until January 19th. I can then indicate if I prefer Monday morning or afternoon, select the times that work for my schedule. I even have a comment box in here if I needed to add any additional comments about my request. I hit submit, and now your provider will get a message stating that you're looking for an appointment during that date and time range. They will either schedule you an appointment or contact you if they're not able to meet that request. Going back to the menu on the left, we're going to go look at billing. Billing is where you'll be able to see your current balance up here on the top left. So I currently have a balance of $58. I can see here I have a statement from 2019 that is unpaid. I can select that statement to view it closely to see the provider and the total charges. And to pay this invoice, I select the current balance button at the very top. I can also see my 2 children if they had any past due balances. Over on the right side, there is a pay button. When I click on that pay button, I can see my $58 balance. I can pay this online. I can also add a credit card on file for any future appointments for easy payments. On the left side, we're going to go back to our messages. So the fourth section down on the left is messages. When I select messages, I see I have an indicator of the number 1, which is indicating I have a brand new message that is unread. This is a referral request and it was sent 29 minutes ago. When I click on the message, I get a preview window on the right side where I can see Dr. Vrieslar sent me a message and it says your referral was sent to Dr. Jane Smith as requested. If I need to reply to my doctor, I hit the reply arrow. This gives me a pop-up where I can type in my message. Hit reply, and this message will go through as a successful action. I can now see it's documented my reply, and I stated thank you to Dr. Vrieslar. If I want to create a new message to my doctor, on the far right I will have a button that says New Message. This will default to my name. I have to put in what type of question I'm asking. If you have any billing questions and you select Billing Question, this message will go directly to our billing department in our corporate office, where they'll be able to assist you with any of those items. If you're needing to send anything to your actual provider that is medical related, you need to choose Message for My Doctor. Under the provider drop-down, if you see multiple providers at Esse Health, including any specialty doctors, they would be listed here. The providers that are available to you are only ones that you have future appointments with or past appointments with. Once you choose your provider, their location should default. The communication is the category that defaults. You do have to choose a subject. When I click on the subject drop-down, I get the option of medical advice or referral request. All referral requests will need the correct information of what provider you are wanting a referral for, the date of your future appointment. Under medical advice, this will be any other question to your doctor. You're going to type out your medical question to your provider's office and then hit Submit. Just like the appointment request, you will get a confirmation that the message was sent correctly. In our message box, we have the option to view sent messages by clicking on Sent. This will show me all of my outgoing messages to my provider's office. I can just toggle back to the inbox to see incoming messages. To review or mark these as read, I can select the checkbox next to that item. I can mark it as read. I can mark it back as unread. And I also have the option to remove or delete these messages. So just like your emails, I can remove these messages so I no longer see them. There are filter and search options up at the very top as well. Under users, I do have my children. I can click on Dominic. I can view Dominic's messages, but I cannot reply from here. If I view this message and hit reply, it is not going to connect to the correct chart. Again, as a parent, I have to come up here and switch to Dominic's actual portal chart to reply to his doctor. I can just choose user as myself to go back to my inbox. The next section is medical records. Under the medical records section, you will see your health summaries, any documents that was sent to you, any results, lab results, and you may have a wellness tracker that will show your last vital signs. On the right side, you're going to see the sections for allergies, conditions, immunizations, medication, procedures, family history, and social history. When these items get updated, you will see the last update date. Your medical records section gets updated after you have an office visit with your provider, and that provider has coded your visit for billing. A CCDA will be sent to your patient portal and update your health summary. To view your health summaries, you can click on View in the Health Summary card, select the item you want to view. This will show you the record of your visit. It's a PDF that you can download and print off at home or save onto your home computer. The next section we're going to go to is prescriptions. When I click on prescriptions, I get one option for refill requests. Currently, I have no results. That just means I've never requested a refill through my patient portal. This is not a list of active medications. This is a refill request box. In order to request a refill request, I'm going to click on the Request button. I have to indicate who I'm requesting this refill for, fill out the required information. Once I get to the provider section, there's a medication required drop-down. When I click on that, this is going to list my active medications that we have for you at Esse Health. I would select the medication I'm wanting to refill, indicate the quantity needed if I want a 30-day or 90-day supply. This will default to your main pharmacy that we have in your health record. If you have more than one pharmacy listed, you can click on the drop down to choose between the two. If you realize the pharmacy that you want the script to go through is not visible, you can select Search Pharmacy. Now this is a national registry, so I find it easiest if you have a zip code or address for your pharmacy. If I put in the zip code of 63122, and then under the pharmacy required drop-down, I will now get all the pharmacies with a zip code of 63122. This narrows down my list where I can then choose the pharmacy I'm wanting my script to go through. I have a free text comment box as well if I needed to add any additional information about this script. You can only request one prescription at a time. Once I'm finished filling out this form, I hit Request. I will get an indicator that my request was sent correctly. Now I have a list here of my request for my metoprolol. If I needed another request, I click on that request, fill the same form out with the other medication I am looking for. The next section on the left side is going to be results. Currently, all of our lab results are going to flow into your patient portal once your provider has seen those results and signed off on them. When I click on labs, I can see my lab results here. Anything that is out of range is going to be a red indicator, and if it's normal, it will be green. If I select the test I want to review, I get the preview window on the right side to see the value of my lab result and what a normal range would be. I can click on this top one, cholesterol. This is where you can see my value is out of range. My result was 250 and a normal range is 0 to 200. If I want to download and print my results, I have a download icon on the right side. You'll get this confirmation action that the maximum number of download file is 1,000 records. Just hit confirm. Your record is not going to be 1,000 pages long. It's just indicating if you have a long history with us, it can only download so many items. Here I can see my results of all my test labs. I can then print this or download it to my computer. Under Documents, currently we are not sending anything to this section. If your office is going to send you any documents or letters, they will come into your message inbox as an attachment. The second to last section is Forms. Forms is going to be where you'll fill out any intake forms for upcoming appointments. If you're a patient at Esse Health and your provider needs to send you new patient paperwork or to fill out any screening tools, those would be listed here. You'll get an email notification 48 hours prior to your appointment that you have forms to fill out. You'll come into your portal, go to the Forms section. Anything that is grayed out, like this COVID screening and influenza form, means it's not available. However, my office did send me this new patient packet and the GAD-7 screening tool. When I click on the form to fill out, most forms your name will be defaulted at the top. However, some forms will require you to fill in information. Once I fill out the required information on my form, there is a submit button, or if it was multiple pages, you would hit next to finish your forms. Once you hit submit, this form will then go to your provider's office and it now comes off your list of items to fill out. If you ever want to review your completed forms, there's a button on the right side that states completed forms. Here I can see all the forms that I have filled out with the date and time stamp. The last section is support. This is our tech support. We do indicate here, please do not share medical information through this form. This goes to our tech support help desk. They do not have access to your health record. Therefore, these questions are limited only for tech support. You would type your message here and hit the send button. You'll be contacted within 1 business day to triage your questions. This concludes your tutorial video. Thank you for watching, and as always at Esse Health, we want you well.